We are back. Well, as artificial intelligence continues to reimagine our everyday life, we want to deep dive into its impact into healthcare.
Oh, and here to help us do that is research scientist and research lead at Google DeepMind, Shek Azizi. Welcome to the show.
Thanks for having me here. Thank you.
Shek, can we start off by you talking about the possibilities that await us in the health industry with AI?
Yeah, for sure, absolutely. This is the area that I'm super passionate about, and I believe that like in 5 to 10 years, AI can dramatically change the way that we are practicing healthcare. It can bring a range of opportunity for us, like from understanding your own medical records better, and also like helping doctors, starting from administrative tasks to help them retrieve information that they need faster and like more efficient, and also come up with more better health for the patient that they are like caring for.
Okay, so we know about AI, but you see the hot topic in healthcare right now are actually large language models, or LLMs. What are those?
Yeah, exactly. AI can learn from a diverse set of data. And in terms of a large language model, or for short LLMs, they're learning from massive amount of text that we are presenting to them. This means, like in healthcare, they can learn from all of the medical textbooks that are out there, all of the medical research, and all of the real-world cases and diagnoses. And this way, they can basically, we can have models that they can handle clinical tasks.
So you say this starts at the administrative level, though. How so?
Yeah, let me give you an example. All of us have been to doctors, and we know that they're taking billions of notes. The way that AI can help here is actually to help with clinical documentation. You can imagine that we can transcribe patient-doctor's conversation in a structured medical format.
Yeah.
And when it's come to assistive support, it's actually going to be like more direct. You can imagine that like you have a virtual assistant, and if you are feeling a bit unwell, you're gonna talk to this assistant about your symptoms, and this assistant can suggest that, okay, do you need to go to like emergency room, or you actually need to go a regular doctor appointment. And also in emergency room, you can imagine that that same technology can help our healthcare worker to identify people that they need more urgent care. So that way we are gonna reduce the wait time that we have in emergency rooms.
Which is great.
Really
I love that idea. All right, so here's something sobering. The World Health Organization is projecting a shortage of 10 million healthcare workers by 2030.
Wow.
And that's primarily gonna be in lower income countries. So how can AI address this issue?
Yeah, you can imagine that like most of the lower income countries, healthcare workers, they don't have access to many resources that we have. And these models that we're like training them on comprehensive medical knowledge, they can basically play a role of a super smart encyclopedia, or a virtual colleague that all of these doctors, they can consult with them, and they can come up with a better treatment option for the patient that they are caring for.
Talk to us more about how that can actually help the patient.
I believe that LLMs and AI can basically democratize health knowledge. And the way that you can like think about it is that most of the time, it's very hard to understand your own medical records. And the reason is that for most of people are either in another language that they don't understand, or it has all of these very complex medical terms that you don't understand easily. And LLMs in particular that can help to translate all of that information in a language that is understandable by anyone.
Oh, wow.
Okay, so LLMs can analyze complex medical text and data, but what about images?
That's the place that things getting like really interesting. Let me give you an example in the maternal health space. You can imagine that World Health Organization recommend for expecting mother to have ultrasound screening, usually before 24 weeks. And it's basically to identify high-risk pregnancy. And unfortunately and sadly, in many low to mid-income countries, there is a shortage of doctors that they can actually perform ultrasound imaging. And that's a place that AI can bridge this gap. AI can guide any healthcare worker to basically take a very good ultrasound image, and or AI that has been like learning from tons of these ultrasound videos can basically identify and spot automatically any high-risk pregnancy. And this technology that I'm talking about is basically right now being used in sub-Saharan Africa and saving life.
Wow. Could there be a day, Shek, when like these robots replace healthcare workers and do all the diagnosing?
That's a very interesting question. I believe that, like, based on all of the example that I gave you, you can see that, like, the way that we are developing this technology is more for assisting doctor. We know that most of the healthcare workers, they're dealing with burnout, and the way that we are designing this technology is to actually give back time to healthcare workers and also trying to optimize the clinical workflow. The technology that I'm talking about is pretty new, but like based on the example that we see a lot of good things happening right now. And the key is to basically develop all of this technology responsibly from the get-go, and that way make it beneficial for everyone.
Just fascinating. Shek, thank you so much.
Thank you.
Really
Thanks for having me here. Thank you.
Truly. Thank you. Okay, that's a lot to think about. Do it on this break. We'll be back right after this.
Hey there, what did you think? Drop your comments below and join the conversation. And don't forget to like and subscribe so you can find more on everything from food and fashion to pop culture and current events. See you soon.